women, not even the men.
Yeah.
The men are always eager to even know.
Yes.
But the women are saying, must you talk? Are you the only person experiencing this?
Yeah.
Is it, it's not a private issue.
Let me just get straight into it. What is Petals and what necessitated it?
So it's a women platform, women health platform. And the reason that we created this platform is because we realize that women needs and health needs are unique to them.
Every woman is expected to be strong during labor.
So what we're doing at Petals is giving correct information so that we empower them so they can make good decisions, and informed decisions.
Now, we're going to talk in this episode about how technology is transforming women's health across Africa. And we're going to get specific on that. But of course, I am not the one going to be talking about women's health. Hi, welcome to the MedSquad Podcast. Now, you've probably seen some trending, I don't know whether they're called topics or just trends on social media where a lady goes and adjusts the clock on the microwave and says, woo, women in tech. Or she does something else like, woo, women in science and STEM and whatever it may be. Now, we're going to talk in this episode about how technology is transforming women's health across Africa. And we're going to get specific on that. But of course, I am not the one going to be talking about women's health. I have some wonderful ladies with me and they're going to introduce themselves.
All right. My name is Eva Waruhiu-Muchai. I'm the VP in charge of women health at Zuri. And I'm excited about women health. I'm very passionate about women and their health.
Yes.
And so I think for me, it's just great to be here just to share the information that we have and see how tech and women health can come together to resolve some of the many issues that sometimes women face, in their health journey, in their reproductive health, or everything about health, really.
Looking forward to that.
Yeah.
Hey, our favorite.
My name is Dr. Kelechi Okoro, also known as the health detainer, and I'm a woman in tech. Yeah.
All right.
My name is Dr. Flavia Bagatya, and I'm a medical officer at Zuri Health, and I'm also very passionate about women's health.
Okay, looking at the big picture, what are the most urgent health challenges facing women in Africa or African women today?
Okay, yeah, so one of the biggest challenges is sexual and reproductive health because of the stigma surrounding it, because of the lack of information, because of this silence culture, again, around sexual and reproductive health, from puberty, from menstrual hygiene, from cervical cancer. We have maternal issues, early pregnancies, unsafe abortions. We have breast cancer, cancer of the reproductive organs, right? These are some of the challenges that women face. Apart from these core health issues, we also have mental health challenges, postpartum depression, which is also linked to maternal health. We have overburdened women because we are in the African environment where the woman is the maid, the woman is the wife, the woman is the sister, the woman is the mother, the woman is sometimes in a lot of climes, we're not talking enough about it. The woman is the breadwinner also. Yes. Okay, and this also has an implication on her health because there are some conditions that come about as a result of stress, autoimmune disorders, and all of that. But I just want to, focus on sexual and reproductive health, and I've mentioned some of them, and also diseases that are not talked about enough, like PCOS, polycystic ovarian syndrome, diseases like even menstrual diseases are associated with menstruation. Okay, this what I'm about to mention is not even a disease, but it's being treated like a disease. But of course, it has some disease conditions attached to it. Menopause, issues like menopause, and these are things that we do not talk about all the time. Yeah. So these are the also early pregnancy, which has a very dire implication on maternal mortality and morbidity. Okay. Also, family planning. Yes. I keep mentioning
the burden seems to
exactly.
Be more
it just seems to be on those diseases or those conditions that are hush hush in the African setting. So these are some of the biggest health challenges, and then we can also link it to lack of information. Gatekeeping of information, and also, like I said earlier, silence about some of these things. Sometimes when it's just recently, like some tech solutions are coming up and you're talking about these conditions openly, audaciously, and then first of all, people tell you, hush, don't talk about it. Like when I started talking about menstruation, women, not even the men, the men are always eager to even know. Yes. But the women are saying, Must you talk? Are you the only person experiencing this?
Yeah.
Is it, is it not a private issue? So because we are privatizing women's health conditions, that's why it's becoming a big challenge. Even something as basic as, a cesarean section, which is a normal birth procedure.
Yeah.
Okay, people, when we talk about vaginal birth, we talk about it as a normal. No, cesarean section is also normal. Mother and child alive and well.
Yeah.
So it's a normal procedure, but it's just a different procedure. So cesarean sections, birth, fertility issues.
Yes.
Imagine as an African woman, you dare come out to say that I'm seeking surrogacy, I'm seeking IVF, I'm seeking all of these wonderful options that are plethora of wonderful options that are available, but becoming a health challenge because some people want to have children and they cannot have children. So they are hush about it and they're not talking about it, and it becomes a problem, not just a medical burden, also a psychological burden.
Yes.
So these are some of the biggest challenges that are affecting women's health in Africa.
Dr. Flavia, you have a few?
Oh, yes. So like Dr. Kelechi has said, women are suffering silently because of these conditions, and information is not out there. They don't know their symptoms, and then also there is lack of access to care. So we are looking at conditions like endometriosis. We've normalized period pain, and people get late diagnosis because of this. Then we look at infertility. Infertility affects about 30% of primary infertility and secondary infertility, and secondary infertility is more common. So some of the causes of infertility are actually preventable. So we're looking at conditions like pelvic inflammatory disease that causes tubal blockage. And what causes pelvic inflammatory disease? Untreated STIs. So people are not seeking the care they need. They're not seeking the treatment they need to eliminate most of these conditions.
Now, based on what you two have told us, there's a lot. And how early will a woman start looking out for these things or thinking about these things? Which now brings me to you, Eva. There's let me just get straight into it. What is Petals and what necessitated it?
Okay, that's a good question. So at Zuri Health, we have a product called Petals. So it's a women health platform. And the reason that we created this platform is because we realized that women needs and health needs are unique to them, right? And so we were like, you know what? And where does a women sexual reproductive health start from? It starts as early as 12, 13 years old, as a young girl, right? That's when your body starts changing, okay? And so for this girl, there's an assumption that she knows what's happening with her body, but no, especially in rural areas, they don't know. And we assume that probably the parents have told them. As one of the doctors said, she said that it's a stigma. We don't talk about such things. It's hush, hush. Maybe your grandmother will tell you about it. What if grandmother is not there? Maybe it's your mother. Maybe what if mom is not there, right? How do they access this information? So we realize that we need to inform them about, what is happening with their bodies, the changes that are happening in their bodies, right? And another thing is that also we realize that this age group, especially between the age of 14 and 18 years old, because they don't understand what's the changes that are happening in their body, there's a rise in teen pregnancy. So they're out there, maybe fooling around, and they get pregnant. Right? But if they were informed, if they knew what the changes that were happening, if they knew that there are certain things that they can't do, then maybe the reduction of a teen pregnancy would come down, right? So these girls, we talk to them and we talk about what I've just talked about. Pregnancy can happen, right? Menstrual hygiene is important because if you don't clean yourself properly, these are some of the infections that you can get, right? Also, what we found in Zuri when we do go to, especially to underserved areas, is that some of the things that they have, there's a stigma about menstruation, right, or periods. They are not even able to go to school. But we're telling them it's okay, it's normal. You can go to school, you can do your various activities, right? So there's that, and there's so much to talk about, just for that age group. Then we get to now the girls have moved now. They're 18 years old. They're out in the world. They're in college or wherever they are, and they're sexually active. Right? Are they using protection? Right? Are they using family planning? So one of the things that we also found that there's a lot of myths and misconceptions about family planning. The misuse of P2s, for example, it is ridiculous, lack of a better word, right? And the effect of that is what people don't know, right? If you continue using P2 for every time that you have sex, there's there's a repercussion for that, right? So what are the safe ways? What are the safe contraceptives that you can use? So we empower them and educate them about the different contraceptives, okay? And again, is an issue because some of them, there's misconceptions, there's religious beliefs, right? But we have to be clear about that information and also just give them the right information. So what we're doing at Petals is giving correct information so that we empower them so they can make good decisions, and informed decisions.
Okay.
Then after that, we move. So we're talking about that age group is between 18 to maybe to around 25. Then 25, maybe the thing of getting married, having babies, etc. Then we start talking about, how do fertility, for example. We start talking about pregnancy, right? And now that's a whole different conversation as well. So how do we empower these young moms, for example? Some of them are, they don't understand breastfeeding. So there's a lot of information that we're giving for each age group.
Like postnatal care,
Postnatal care, vaccinations, and all that. Yeah. So we actually have an ANC program for the moms, right? And postnatal. And again, one of the things that we have found that is becoming very common is postnatal depression, which the doctor clearly told us, right? And people don't talk about it, and it's unknown. Actually, people don't even confess that they have it or they had it, right? Because it's almost like a taboo. Like, how could you? Those are, sorry to use this word, those are Western problems. African women don't get that, but they do, and they suffer in silence, right? So how are we able then, how is a woman able to know, I'm not feeling normal. Yeah. I have mood swings, all right? Or whatever the issues are, should be able to, the woman should be able to discuss this issue so that then the doctor can be able to detect and say there's a problem here that needs attention, right? And then, after that, now we get into perimenopause and menopause, right? For a long time, our mothers didn't talk about menopause, right? But we need to bring it to the forefront because it's a normal hormonal change that is happening to this woman, right? So let's talk about hot flashes, right? When a woman is sweating, let her sweat in peace. You know what I mean? Don't judge her. If she's adding weight, what can she do about it? Who can she talk to? And at Zuri, we have the mental health specialists, we have the nutritionists, we have all these resources that are there. So that is what Petals is, and it's a digital platform, so they can be able to access that information. At the end of the day, we say information is power. And once we empower this woman, she'll be able to make the right decisions for herself and for her family and for her health.
Hey.
Okay, so please, can I throw in something?
Yes, please.
The Hebrew woman phenomenon, where every woman is expected to be strong during labor. You're not supposed to you're not supposed to shout when you're going through labor. You're not supposed to desire epidural. You're not supposed to even you're not supposed to wish for a painless or a seamless.
So your pain is taken for granted.
Yes, it's taken for granted and it's glorified. So these are some of the biggest challenges that, in fact, some women do not want to have children because of the pain that they have heard about when it comes to labor. Okay, and there's something else she said about the rural girls not having this information, not knowing all of these things. I want to burst your bubble that even the woke girls, the woke women, the women on social media doing TikTok and dancing on my piano and going to Dubai and, having all the Vida Loca life, they do not also have this information. In fact, as a medical doctor, the information I have about menstruation, period pain, menstrual pain, premenstrual syndrome, the PMDD, the severe consequences of periods, I didn't learn them in medical school. I learned them from my personal experience as a woman. And it has been belittled and trivialized by my fellow doctors or doctors I have gone to for treatment. Because in the text, it was not described the way I am feeling it.
Does this include female doctors?
Yes. Includes female doctors, male doctors. The text doesn't clearly, depict the real pain, the real experiences that women go through during periods, during menopause, and whenever they feel whatever it is they feel with their sexual and reproductive health. So that's just what I wanted to put in. Yeah.
Is this something you wish you had growing up?
So also, as women, we're different. What someone's experience might be different from yours. Someone may not experience any period pain, and the other person is experiencing period pain. Someone can have ease in giving birth, and then another person is having problems with fertility. And then when you look at fibroids are caused by prolonged exposure to estrogen. But then you find that even women who have given birth to up to 6 children still have fibroids. And you can find that someone who doesn't have a kid has one tiny fibroid. So it's different. It's different for every woman. And it's important to learn our bodies.
Do you wish you had this access to something like petals when you were growing up?
I wish I did, yeah.
Yeah.
Oh, yeah.
Wow.
Yeah, I wish I did. And she's very right what she said. Even the urban girls, you talk to them and they're clueless. And like, where are you getting your information from?
Yes.
So we need to put this information in a place where they can be able to access it, right? And so what we have done at Zuri Health and with Petals is that we have different groups. And maybe I can talk about that now or later, is that we have to categorize the different women.
Yeah.
So we actually have WhatsApp groups. So for the Zuri group, that's between the age of 14 to 18. Of course, the parent has to consent for them to join the group, and we're able to share that information. And they can actually even ask their questions, right? So they can even DM our nurse or a doctor. Mostly it's our nurses who are moderators, and they can ask a certain question about what is going on. They can say, I'm having period pains, and probably should be able to be given a diagnosis and be able to give them medication, of course, with the parent's consent, right? Then we have one for the young girls, 18 to 25, as I mentioned, and we call it babes, because they're the babes, right? And you'll find that the questions in those groups is all about that. It's all about STIs, for example, UTIs, what are the causes of UTIs, contraceptives, where can I get the contraceptives? Some of them even go as far as asking, where can I get a safe abortion, all right? So we direct them to actually even institutions where they can be able to get some of these services, right? And that's what we're supposed to do. Let's empower these girls, right? And what you're doing is wrong. Take care, use protection, etc., right? So there's also a WhatsApp group for that. And it's very active. Again, you'll find that for the moms as well, we have a group, a WhatsApp group, so we call it Zuri Moms. So the Zuri Moms is a nice place to be as a mom because you get different hookups. Where can I get a nanny? I am not getting enough breast milk. What should I drink? etc. So that kind of community also helps. And again, as an African woman, that's what we did. That's what the villagers used to do. And then the women would come together and empower each other. So that community is very important. And then the beautiful thing about it is not just women throwing out answers and suggestions, but also it's moderated by a medical person. So it is actually information that is medically backed, right? Then we have the bloom, Zuri Bloom. As women who are going through menopause, is nothing to be shameful about. Actually, you're blooming. You are actually at the stage where you should just be, you're so powerful in terms of the information that you have, the confidence that you have. So this woman should actually feel good about herself. Again, how do we empower them at that stage? So we have different groups of different women.
So we've created a safe community or a safe space where we talk about these conditions openly. It's not a taboo to talk about these conditions.
And then I also want to call out the babes. There are babes who, they look like babes, they act like babes, they say they are babes, and they do not know that there are 3 holes when, in the vulva, right? They do not know that the hole where the period blood comes out from is different from where the urine comes out from. I'm not lying.
Don't know.
I've had women ask me such questions. They don't know that they don't know that the hole where that the ureter is different from the vaginal opening. They do not know.
And all this information is available.
Of course.
Yes, it is on the Petals platform. Yes.
And also it's available right here on the MedSquad podcast. When we come back, we'll be looking at how that gap is being bridged and what else can actually be of use to a young lady growing up in Africa. Stick around. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the MedSquad.
Here, care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the MedSquad. Real conversations, real health, real people.
From your inbox to your bedside, we're with you.
Welcome back. This is the MedSquad Podcast. I am Efesi and I have Eva, Kelechi, and Flavia with me. We're talking about when tech meets women's health. Now, we've talked about health issues that can be, medically verified and things like that. But now, as a woman grows up, there are so many complex issues that she faces just by virtue of being human. When it comes to thinking about career, when it comes to thinking about relationships and all other social things. But in some places, the reality is, as inspired as you may be, as ambitious or as educated as you may be, culturally there's a ceiling. Or you can come with all your education and the only question they want to ask you is, where are the children, where are the grandchildren? So how that comes back and affects a woman's health. Where do you see tech bridging that gap or meeting that need?
Okay, so what tech has done, it has spotlighted women like me who have crashed the glass ceiling. Basically, I have crashed the glass ceiling.
Yeah.
I'm 37, and my social media followers know that you cannot come at me and troll me for not being married.
Yeah.
You cannot come at me and troll me for not having children, because if I troll you back, I'll ask you, do you have money? Do you attend? Are you a speaker at conferences? Are you changing lives? Are you impacting lives?
Yeah.
What have you built? How are you helping your community? What is the impact? What is the impact you're adding to the society beyond just being a woman, having a vagina and a womb? Because women need to, we need to start respecting women beyond what they stand for biologically.
Yeah.
We were not thrown into this world just to be maids, just to be mothers, just to have, no. Women can be more, and women should be more. There's something I always say, there are 3 categories of women. That woman who just wants to be a housewife and she just wants to have a good family, a husband, children, live in the suburbs and enjoy her life. And that's valid. We have the other set of women who just want to be career women. They want to do things that nobody in their villages have done. They want to sit at tables where only men have sat.
Yeah.
And that's okay. And we have the 3rd category of women who want to be both, and they can be both. And guess what?
Yeah.
That's okay.
That is okay.
But what tech has done, especially like platforms, especially with platforms like Petals, aside coming to that platform and getting medical information, there's and getting, that support system. You see women who tell their stories. You see women who do not want to have children. You see women who are pursuing surrogacy. You see women who are experiencing things that you thought were not normal. And they're telling their stories easily. And they're like, oh, this is possible. And that's what tech, that has been made possible by tech.
Yeah.
And also, like I said, men have been gatekeepers of women's body, women's health information, women's access to, reproductive health, women's access to contraception. It has been men telling us that you should do this, you should have this so amount of children, you should. When those rules were made, I don't know how many women were seated at those tables. Men have kept all of this information and all of this, and then it's been passed down. Okay, so they pass it down to the elderly women or the high, according to hierarchy in the society.
Yeah.
They tell it to that woman, and that woman passes it down. So what that does, because it's in a local setting, it's in a community setting, it's by word of mouth.
Yes.
It's not evidence-based. It is not backed by any lived experiences of others and then compared to other climes. So what tech does is that it is evidence-based.
Yes.
You're having an intersection of women from different parts of the world. You're seeing that this is possible. It is possible in France. It can be possible in Kenya.
Yeah.
It's happened here. It can be possible here.
Yes.
For example, in the Western world, they were able to, get the freedom to access to safe abortion
Yes.
more earlier.
Yeah.
And because of tech, because of social media, because of that intersection, you don't have to leave. You live in Kenya. You don't have to take a flight from Kenya to attend the UNGA, to attend the UN Women Conference. You don't need to leave your house. All you need to have is a cell phone, internet, and then you're connected to the world.
Yes.
Even if you do not have that big sister or that big auntie in your community, the only person who has a phone has access to it and can be passed down to those who don't.
Yeah.
So because of this interconnectivity and access to beyond your locality or beyond your vicinity, we're able to see, oh, okay, we can start to call for reforms for abortion laws. We can start to call for reforms for population laws. We can. So, what has made this possible? Definitely tech.
Yeah.
Okay, yeah. So,
with technology, that okay. With technology, there's a lot of information out there.
Yep.
So we can, as women, we can reach out to the internet and get this information, get informed. But also we're looking at apps like the period tracker. Someone gets to know their body better, because those days would ask someone, when was your last period? And they don't know. But now most people you ask, they pull out their phones and she tells you with confidence when it was.
Yeah.
So you see, with that, even for antenatal care, you're trying to get the date of delivery of this lady, and she tells you, I don't remember, I don't know. With technology comes a lot of information. So now information is more accessible. And then with this information, we're empowered. So we have the period tracker, apps like the period tracker, where a woman knows about her body better. So she walks into a facility, and then we can ask her, when was your last period? And she can tell you with confidence when it was. And this is most especially helpful with antenatal care. Like, you want to estimate the date of delivery, you can easily do that when you have this information. And also we're looking at conditions like PCOS. Someone has had an ovulation, they haven't ovulated for, so she comes when she knows her symptoms because of these apps.
Okay. So now this pressure there is petals going to migrate, because what I've had here, apart from this choice, there's dignity, there's accessibility, there's validation. Does this form any of the ethos of petals?
Yes, it does. Yes, it does. And I'm glad you talked about the period tracker. Now, we've even gone beyond the period tracker. So now we even have a menopause tracker. And what that does is that you'll find that there's certain symptoms that are triggered by certain things that you do as a woman, right? So we are able to ask a woman, can you track your emotions? Can you track, your activities, right? Can you track anything else that you feel that you need to? So you can track your emotions by saying, today I was feeling anxious, I was feeling sad, right? And then your activities, I walked, or I was just at home, etc. I had pressure at work. Because then what that does, because of AI, is that we're able to get a trend. It's like, oh, this woman, when she eats certain food, she gets hot flashes. All right, if she takes coffee after 1 p.m., she's not able, she gets insomnia, right? So what happens is that when she takes that information to a healthcare person, whether it's a medic or a doctor or a nurse, then we're able to see, so this is what happens. So maybe you need to stop eating this food, or maybe the medication that we gave you is giving you 1 to 3 symptoms, or it is working, right? So maybe this fitness regime that we gave you is actually working. You're able to lose weight. So now you're seeing that your moods are actually better. So that is what, and we are using an AI system as well, because that's what it does. So after you put in all your different emotions and activities, etc., over time, we're able to, come up with a diagnosis, say, these are some of the things that maybe you need to stop doing, or these are some of the things that you need to do. Yeah. So that was what tech has done.
Eating from the plate that she has graciously served, right? AI is not just helping women's health. It's also helping the solution, the app or the
platform,
the platform to improve their services and the quality of care that they give to women. Remember I said earlier on, there's not enough research when it comes to women's health.
Especially African women.
Especially African women. These researches were done on the Western women. And trust me, our level of estrogen is different. The way we react to estrogen withdrawal and estrogen overload is different. So you're talking about the things we know about women and women's health. The things we've always known, that not totally, but quite significantly different from our reality. For example, let's talk about fibroids. Fibroid, if you have a fibroid, right, maybe you have multiple fibroids in delicate areas of your womb, and you were diagnosed abroad, there's a possibility that you could get a hysterectomy, and that's removal of the entire womb. But if you have, I'm putting it to you with my full chest, that if you have such fibroid in a village like the one I trained in as a medical student, the doctors there, the surgeons there, without ultrasound guidance, they would have just had a previous ultrasound scan before the procedure. But without ultrasound guidance, they would remove the fibroid one after the other and preserve your womb.
Yeah.
Because it is important to us in the African context. It is important. Womb is very important.
Womb is sacred.
It
Yeah.
is.
Womb is very sacred
Yeah.
in the to the African woman. But if we are relying on the information we're getting from the West, then we will not prioritize what is most important to the woman and to her future plans. Okay, so now going back to what I was talking about, from the app, what did you eat? How did you feel? What did you do today? Remember that with the Petals product, what it is doing, like, okay, for the trackers, you're asking beyond just how much pain you're feeling when your period started. The app is asking you, how did you feel today, 2 days before your period? What did you feel? What did you eat? What made your period experience better? What made it worse? What it is doing is the AI system is learning. Remember, AI is not more intelligent than humans. AI is most effective because of what humans impute.
Yeah.
Exactly. So we're feeding with the continuous use of these apps. The AI is learning and is helping the AI to, serve women's health better.
Correct.
So it's a two-way thing. The AI is helping women's health, and women's health is also helping the AI to make women's health better.
It's true.
Yes.
It's actually empowering them, right? Because now, at the end of the day, if I eat oats, is when I get hot flashes, right? That is what now I've realized. Then I will stop eating it, right? So it actually, you're able to manage whatever you're going through, whether it is the different symptoms that you have. So as you correctly said,
Yes,
it is, and especially even for African women, I like the example you gave about fibroids. We know that we as African women have a higher chance of getting fibroids compared to the women in the West, right? And how can AI help us, what can we do? What I am praying for the day where we can be able to discover why African women are more susceptible to fibroids compared to white women. And I'm sure it's coming soon.
Yeah, it's because, scientifically, it's because of the increased estrogen. So now we can relate it to our diet. What are the kinds of foods that we eat that is estrogen rich, right? So if you're prone to fibroids, you're getting to the age where you're, susceptible to having fibroids, or you have a fibroid, or you have fibroids, the kind of foods that you eat. So when you impute it into this app, okay, what did you eat yesterday? What have you eaten in the past? So while women continuously use this app and feed the AI with new symptoms, remember these symptoms were shipped. They were the studies were done in the Western world, most especially. So now the AI is picking up new symptoms that didn't seem like symptoms. Sometimes that's why a lot of times women go to the hospital and they come back unfulfilled, because you've mentioned symptoms that just feel like, maybe it's just go home and relax and go and talk to your husband, or just go and hug your kid.
Yeah.
But it is a symptom. So the AI is picking this, and then is using the data that they have gotten to improve their knowledge about that particular illness.
Yeah.
So it makes even when you're training doctors or nurses or medical professionals that you come across, when the patients come to complain about these symptoms, the doctor is able to know that, okay, this is a symptom of this particular condition.
Yeah.
So that's what you're teaching the AI to know more symptoms, localized symptoms, localized foods, localized local behaviors that are peculiar to that particular condition.
Machine learning. Yes.
Yes. So technology. Technology has also improved access to healthcare, especially through virtual consultations and telemedicine. You find that in places where the doctor or the gynecologist is far from the patient, the patient can actually easily access the gynecologist and tell them their symptoms. And also, you find some pashai. Through, at least with technology, it can help a bit. And also, people are getting over-the-counter medicine. Maybe someone has an abnormal discharge and they can get medicine from the chemist. But now with virtual consultation, you're able to get a diagnosis and get the right treatment for that illness, whatever you have. Then also we're looking at diagnostics. We're looking at mobile ultrasound scans. They can even find you at your home. And then you can also do pap smears from your home through the access of AI. We're also looking at educating retraining, having CMEs for medical doctors, for health workers, especially about conditions surrounding women's health. We're looking at conditions like endometriosis that take an average of 7 years to be diagnosed.
Wow.
So people suffer in silence for 7 years
Yes.
because there's little information about these conditions. But you find if medical workers, if the first contact of care is trained about this condition, they'll be able to refer them to a gynecologist and they get proper care immediately.
All right. So now, of course, that you've had all this the AI. Now, I don't know if you have it on you because this information is also being fed in. So, what's the future then for Petals?
Petals, we have to officially launch it to women, right? So we're already in testing phase and it's been working wonderfully, but we have to put it out there to the world so that people can test it. The more, as you say, the more people who test it, the more the AI is able to get more information, the better it becomes in terms of diagnostics, right? But over and above that is that then the women also have now access and virtual consultations are available. So you can speak to a doctor, you can speak to a nutritionist, right? You can speak to a physiotherapist, depending on what the issues could be. Sometimes you find that women, when they get into menopause, they start have issues with their joints, and how can the nutritionist be able to assist them in what to eat? How many physios, for example, do they need? And so all the different specialists that we have, will have access to that. But over and above that, the community bit, I think that for me is the most important, especially as African women. We borrow from each other, we learn from each other. And so that somebody knows, oh, so I'm not on, you'll actually find some people suffer alone, but when they see that the other people who are going through the same experience, they're like, I'm not alone, you know? So just giving women that kind of platform where they can be able to express themselves freely, talk to a doctor virtually in a very confidential way, have access to different platforms where they can be able to access information. As I say, information is power. And we have to empower these women to take care of their health and to manage their health better. So that's the future for Petals.
Well, on the MedSquad podcast, we hear it a lot. And not just on the podcast, but even in society. Listen to women and take them seriously. Well, Petals does exactly that. And look out for the launch. It's probably already launched by the time you're watching this. And of course, this information that you've received here about women's health and how tech bridges the gap is so important. Please share it with your aunties, your sisters, your nieces, everyone around you. Share the episode, and even with the men. Please, men need to hear some of this. In fact, all of it. Follow us on all our socials at the MedSquad Pod. And we'll see you next time.